we have the ability to not just think about regions now. We can start getting a little bit more muscle specific. Groups of muscles and or individual muscles and how they neurologically coordinate with each other. And what we're going to be talking about right now are contralateral reflexes regarding gait. All right, so going back to the baby story, when we learn to crawl, it's going to be contralateral reflexes that need to be the strongest, the most concentrated at the hip to the shoulder. And that's what we're first building up when we do that. Then there's the reflex of just like standing up, which then has bilateral actions of things working on both sides. Then once we start getting into walking actions, one thing that tends to happen is there's kind of more of this waddle, okay? Now, with a waddle, if you think about what we're using, and this also happens to a person that starts not being good at walking, okay? Starts to turn more into a shuffle and a waddle gait. It's like you're de-evolving, right back into infanthood, all right? And you're using, what even a toddler is using, is their adductors and their abductors as balance muscles. Because we need to be able to coordinate, eventually, the ability to do this, instead of doing something more like this, topsy-turvy. Even if I was balancing on something, balancing on a tightrope, ideally I'm not going back and forth and have a chance of falling, right? I want those muscles to get strong enough where, although they might be working, one side's shortening, one side's lengthening, that they're all working together, but I am able to control being on one leg better and better. I can't do that unless I exercise this, like jumping jacks and things, or like a mobility thing that people do, right? Okay. And then, once those are good and strong, now they're going to, when I'm on one leg, keep me from tipping side to side so the other muscles can carry me forward and backward. Predominantly forward, but it's easy to forget that we have to be balancing on one leg using our adductors and abductors while we're doing the swing thing that's flexion and extension. You cannot do flexion and extension good if you don't have good balance. That's it. So bad balance people, adductors, abductors. Okay? If they at least have balance, but the action they're having issue with is in true locomotion, you're in the sagittal plane, and it's going to be about flexion and extension patterns. And then we can do a pattern here where, like, even using the kinetic chain stuff, it all correlates, but we can say shoulder with hip, elbows with knees, wrists with ankles, hands with feet. If we go to specific muscles more, we can even go to, I'll use red for this. If we even use the torso, it's cervical stuff with lumbar stuff. Mobile parts of the spine. They have to kind of work together to make sure my head is level with the horizon and that my pelvis is oriented correctly so my leg swing is okay. If we go out from there, we're in the shoulder territory, but then let's get more specific there. We have this deltoid muscle. And its main counterpart is the glutes. Then we end up in shoulder flexor territory, which is going to be your brachii somethings. Now it's deltoid as well, so there's going to be some cross bridges here, okay? But you got your brachii somethings, and some of them are going to pass the elbow, some don't. And those are going to correlate with the hip flexors, which are a bit more concentrated. There's no hip flexor there for you to go to. So these with that. Okay. Then we get to our elbow flexors. Elbow flexors with knee flexors. This is where we have to flip it all over. I'm sorry, I missed a thing with the shoulder extensors. How many colors do I have? We're going to go to red for that one. So shoulder extensors should also be have to do a 2-color thing. That's what we'll do. So shoulder extensors with hip extensors. And color differentiation isn't the best there, but. And then we get to this knee extensor. That's purple again. Ah, my system. Knee extensors with elbow extensors. And then you get to this. This at least will reflect how a person's going to lay for you. But that's where it gets a little confusing. Remember the anatomical position versus a person. People stand like this, thumbs forward. Okay? So they're just slightly pronated. But when they lay, they may fully pronate and internally rotate at the shoulder. At least that's what this picture is doing. But then that means I have to remember that. Remember that this is the anterior side of the lower arm. So anterior with anterior and posterior with posterior. And where we have muscles and areas where there is a lot of overlap is where a ton of confusion tends to occur. So some places, like the shoulder, where we have extension of the shoulder as well as a abduction of the shoulder. That deltoid muscle, those cross bridges can get confused. Here at the hip to the knee, hamstrings working at the hip and the knee, stuff can get confused there. Triceps working at the shoulder and the elbow can get confused. But more important, oh, and I won't worry too much about the lateral medial. But this kind of paired group, it's different than kinetic chain. Kinetic chain predominantly talks about how stress patterns work their way up and down the body, mostly at the key jointed parts of the body. But beyond that, we can go to places where recognizing how do individual muscles and how they function in each region, neurologically they directly correlate. So, somebody has an injury to their left shoulder, and I can't work there too directly because the injuries may be a little bit acute, there's nerve impingement, something like that. The most neurologically paired region would be the contralateral muscles of the hip. So it'd be the right glutes, right deep lateral hip rotators, stuff like that. Somebody has an injury to their right elbow. I could think more about the left knee and the muscles specific there. So this turns into a case where both systems allow you to kind of think about assessment. This one I tend to use more for like a postural assessment, a person standing in front of me and I'm looking for asymmetry. When they walk, I'm wondering which part of their body they're like putting too much stress on and what areas of the body aren't working enough. Then once I've identified elements like that, as we're doing our massage stuff and we're palpating, it begins to be this compare and contrast. How does the symptomatic shoulder compare to the non-symptomatic shoulder? Okay, comparing the muscle tone there. Identifying what's wrong here, that's your easiest pathway to being like, well, your problem's with your left shoulder, I'm gonna work on your right shoulder, and then compare it, and the things I feel different in the left, I'll assume are dysfunctional, things that should be changed. The muscles I find that are dysfunctional here, I could then think about correlating muscles in a more neurologically in tune region of the body to get a more profound effect. So that's how you can start getting bigger and bigger. And then it gets down to the individual muscles. And when you get more fully into this, it helped me memorize the muscles a lot to be thinking like this. One, it works from a practical standpoint of what you would actually use, like I was saying, like when you really want to start figuring out how to help a person. But also, all right, deltoids are the glutes of your shoulder. Hamstrings are like biceps, or like brachii somethings. The adductors are the lats and the pecs. The quads are like the triceps. The flexors of the forearm are like the Achilles muscles and the deeper muscles. The extensors of the forearm are like this tibialis anterior stuff. And learning both, and sometimes going back and forth like that, helped a lot.